When it comes to fighting an epidemic like HIV/AIDS, one huge concern is funding. Historically, Nigeria has depended heavily on donors to provide funds for its fight against the epidemic, but that may soon change. Ada Ezeokoli reports.
Nigeria's recent NACA survey, the largest HIV/AIDS survey in the world, revealed that the numbers of Nigerians living with HIV/AIDS are not as alarming as we once believed. Director General of the National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu, in an exclusive interview with Nigeria Health Watch, gave Nigeria a score of 6/10 in its fight against AIDS.
We are working hard to ensure that HIV is controlled in Nigeria. And if you ask me on the scale of 1 to 10, where are we in terms of our effort to control HIV, I can say 6/10 at the moment, yeah. Today, we have on our data about 1,100,000 individuals that have HIV and are on our record taking medication. Our estimation is we have about 1.9 million living with HIV in Nigeria. So there is that gap of individuals who have the disease, but we cannot account for them simply because they don't know they have the disease, or they know they have the disease, but they find it difficult to come forward to take medication where they can be on our list, or where we can count them.
As the epidemic shrinks, Aliyu says donor funding will follow suit.
Controlling HIV is the first phase, and the second phase is sustaining the control. And that is where what we're talking about will come in, where the donors may probably feel that the support that Nigeria needed, Nigeria has gotten it. So now is for Nigeria to take responsibility going forward and ensure that Nigeria is in charge. Part of our responsibility now as the donor is disengaging. We need to come in and show to the world that we have structures in place to ensure that services will continue to be provided for people living with HIV/AIDS, and HIV will continue to be under control in Nigeria.
Nigeria is putting in place measures to ensure that funding for HIV treatment and care is secured, including a trust fund for HIV that harnesses the power of the private sector. According to Premium Times, former NACA DG Dr. Sani Aliyu disclosed the plan to launch the trust fund in November 2018 on World AIDS Day. He said the seed money for the fund is about $15 million. Dr. Gambo Aliyu said the launch may happen before this year is out.
We are about to launch HIV Trust Fund. We have processes that have gone far in terms of doing the legwork to ensure that comes to fruition. We are hoping before the year ends, we get the HIV Trust Fund on board. What this will do is to mobilize funding from private sector, to be largely private sector driven. And these funds will be utilized in buying commodities, in buying drugs, in buying kits that will replenish our stock, which is majorly what the funders now, or donors, are doing.
NACA also wants states to put aside a percentage of their consolidated revenue fund for HIV care and treatment.
HIV treatment and care provision will be handed over to states down the road. But before then, there is the need to have a mechanism in place. And this mechanism will ensure resources are available, resources are mobilized, and there is no interruption in terms of the flow of these resources. So we had pledged by governors to make available 0.5% to 1% of their federal allocation to HIV programs in their states. And we have been in the process of following up on this. We are hoping this will come to fruition at the same time when the HIV Trust Fund is coming in place.
Aliyu said the NHIS scheme and the Basic Healthcare Provision Fund are two existing avenues through which NACA expects funding cover for HIV/AIDS.
Instruments of governments like the NHIS Trust Fund, NHIS scheme come into place to provide some services for HIV individuals across the country. And we look at additional programs that we have that are existing, like the Basic Healthcare Fund, to also provide some services, for HIV in the areas of prevention of mother-to-child transmission of HIV or eliminating mother-to-child transmission of HIV.
At a time donor services are shrinking, NACA hopes that these initiatives will be strategic enough to ensure that Nigerians living with HIV/AIDS will not have to go without care and treatment. For Nigeria Health Watch, I am Ada Ezokoli.
Do you think NACA's plans are robust enough to make up the funding gap Nigeria will eventually face? Are there other options Nigeria can explore? Drop us a comment on any of our social media platforms. I am Betty Baye. Thanks for watching.